Good morning, parents, and good morning, friends. Happy Sunday to all of you. Thank you so much for joining us. And today I'm live here to discuss about a very important topic, and that is related to our kids, our children, and that is about the health and fitness of our children. And to discuss this topic, we have with us Dr. Vineet Kwatra. Let me invite him more about the health of our kids and how should we look at the medical test, how should we plan, when to plan, what test to plan. So yes, good morning, sir. Good morning.
Good morning, ma'am. Good morning. Very good morning to all the parents.
Yes, welcome to you, sir, and welcome parents to this question and answer sessions. And I welcome all parents to put forward your questions. On behalf of you, I will take it to Dr. Vineet. And with us, we have Dr. Vineet Kwatra. He is a senior pediatrician and neonatologist with 24 years of clinical experience. And he is the head of pediatric and neonatology department at Fortis Hospital, Manesar. Sir, over to you for a brief introduction about yourself.
Thank you, Dr. Rekha, for inviting me for this wonderful session. So, beautiful Sunday afternoon, I would say. A hot Sunday afternoon. So, good afternoon to all of my parents and all who have joined. I'm Dr. Vineet Kwatra. I'm having an experience of more than 23 years in the field of pediatrics and neonatology. So I have been working earlier with Paras Hospitals, Medanta Hospital as Assistant Director Pediatrics. And I normally look into all kinds of infectious diseases, neonatology, and asthma and pediatric allergies. So this is my brief introduction. And again, thanks Dr. Rekha for inviting me for this wonderful session. So maybe we can start the topic.
Yes, sir. Thank you so
Not
much, sir.
wasting much time. Yeah.
Yes, sir. So this topic is about yearly medical checkup for children. So till date, we know that all adults should go for yearly medical checkup, but now we are discussing about children. This is again very important, and Dr. Vineet will tell us why is it so important and what tests should be considered for the yearly checkup.
Yeah. So, first and foremost thing is that see, child health checks are significantly very important to diagnose health issues in children at a very early age. It normally helps us to recognize the symptoms of common childhood diseases and diseases which may lead to problems while our kid is growing further ahead. So normally one may wonder that should I take my child to a pediatrician even if he is doing fine, or just I have to visit a pediatrician only when he is ill. So for my answer to the parents is, though the child is absolutely normal, I would suggest that health checks are very important on a right time at a right place. That is very important just to prevent our babies from getting regular infections and to prevent those things. So if I say prevention is better than cure, that is the right notation, and that's why we should basically really go ahead and get our health checks, regular health checks with the kids.
Very rightly said, sir. Prevention is better than cure, and yes, we
Right.
cannot neglect our children. We have to prevent them from all kind of diseases, and you know that seasonal
Right.
diseases keep changing and keep coming every season. So we have to
Absolutely.
take proactive step in preventing diseases for our children. So, at what age do you recommend yearly checkup?
See, Dr. Rekha, normally we say that the yearly checks, they start immediately once a baby is born. So I would, distinguish it age-wise, I would say. So let's come to 0 to 1 years, and then from 2 to 6 years is the second phase of childhood. Then 6 to 12 years is approximately the puberty phase of childhood, and then 12 to 16 years is basically the adolescent age, where different set of diseases and investigations required, right?
Yes.
So these are the four phases where we divide our childhood, starting from birth till 18 years, and accordingly, there are certain diseases which we have to look into and then investigate accordingly.
Wonderful. Yes, sir. There are four different. You have very well mark them into four categories, and so we can
Yeah.
plan the health check according to their age group. Yes, parents, if you have any questions, please share it on the group and I shall take it up. And so going forward, if for the newborn babies till the age of 1 year, how frequently is the health check scheduled?
See, Dr. Rekha, normally a newborn baby normally has a health checkup at starting at day 5 of life, then going to 2 months, 6 months, and 14 months. Then come, sorry, 2 months, 6 months, 9 months, and 1 year. So these are the five sets where we call our babies for the checks. So this is where your pediatrician or neonatologist will call you. And what checks they do is basically it is the growth and development of your baby, where we check the weight of the baby, the height of the baby, and the regular milestones which we regularly check for the baby, so that if any discrepancy is there in the weight gain or milestones, then we investigate the child accordingly. So to shorten it, for the first year, the visits are 2 months, 4 months, 6 months, 9 months, and 1 year. So that are
Right.
the four visits which are necessary for a baby till 1 year of age.
Wonderful. So, like in this, during the 1 year, we just focus on vaccinations, but do you also recommend blood tests for the babies?
Yes, see, you have to understand now. See, there are diseases which we really have to look into it. So normally we say that if a child is, we know that breastfeeding is the best feed for the baby, right? But sometimes it happens, that we find babies who are more on, the other milk forms like the cow milk and all those things. So in the first year, the most important thing which we find in babies is nutritional deficiencies, right? And vitamin deficiencies. So nutritional deficiencies, most of the kids are anemic. They come to us after 1 year of age with a hemoglobin of 7, 6.5. So that is what I'm saying. To prevent those things, better to investigate a child for nutritional deficiencies, like get the normal complete blood counts and the hemoglobin levels, and if required, if your pediatrician says go for the iron deficiency, iron studies and vitamin D levels. If your child is not growing well, if your child is the weight gain is not good, the proper height as per the age is not going great. So that way, and then we as pediatrician neonatology, we look into if there is any cardiac anomalies. So we go ahead with
Right.
the X-rays, we go
Yes.
ahead with the echos. So
Right.
there are a lot of things, but to shorten up, these are the basic investigations we should really look into.
Right. So, parents, for the babies less than 1 year, the clinical assessment first and then the blood test.
Exactly,
Right. So, going
exactly,
forward,
very true.
sir, between the children for between the age group of 2 years to 6 years. So,
Right.
what should be the pattern of medical checkups a parent should think of?
See, Dr. Rekha, first of all, our parents should understand that we, like I told you on the first question only, that we come to the doctors only when the child is sick. You know, so that's not that mindset should be changed now. Okay, so there are diseases where we look from 2 to 6 years of age, where we really look into it, and we really have to go for regular health checks and investigations if required. Okay, so let's first see why do we need medical, checks at 2 to 6 years of age? So I would put it that more. So there are certain diseases like malnutrition, nutritional anemias, worm infestations, dental ailments, skin diseases, which includes the allergies, eye diseases, and the most important thing which we are finding these days is obesity. Okay, so
Obesity, right?
these are the basic 2 to 6 years diseases which we as pediatricians, really look on regular health checks. And accordingly, we investigate the child for, say, nutritional anemias. So vitamin B12 we have to investigate, iron studies,
Right.
vitamin D levels, stool examination, all these urine examination, because during this age, bedwetting is very common. So babies, they come to with UTIs, urine tract infections. So that's why I say that yes, regular health check along with investigations as per the requirement is a necessity at 2 to 6 years age also.
Right. So I have a question from Sweta Singh. She's writing, hello, I have my daughter is 6 years old. She did very well till the age of 3 years, and from last three
Right.
years, she's not gaining weight. She's very skinny,
Mm-hmm.
looks pale, and is very. She gets very frequent cold and cough. What should we do?
Okay, Shweta, first of all, don't worry about these things. So, your a baby, I suppose, is 3 years, right?
6 years now. Till three
6 years,
was she,
sorry. Okay,
till
yeah.
three was
She was
fine, but
fine.
from 3 to 6
Okay.
years, she's not gaining weight.
Okay, so see, Shweta, this is a normal pattern of a baby, but like I told you earlier also that you should, if your baby is not gaining weight, and if you find your baby was absolutely fine till 3 years of age, and from 3 to 6 years of age, she is, you find her being getting lethargic, you find her that she is not eating well, or she is very sleepy, she is not that active in sports and all those things, then yes, you should go ahead. Like I told you, you should go ahead to check out for the nutritional deficiencies and vitamin D levels that are more important. Get an ultrasound done, a basic ultrasound done, so that we have to rule out any other abnormalities. Because a child should be gaining weight approximately 1.5 to 2 kgs every year after 1 year of age. So if your child's weight gain is not there and the signs which I am telling you, if those things are there, then I think you should really go ahead and get these tests done, and maybe then we can take forward further things.
Right, wonderful. So the children should gain weight at least 1 kg a year. Is that right, sir?
Exactly. 1.5 to 2 kgs a year is a necessity which I would suggest the baby should gain weight. And
Right.
yes, the height gain is also important for the baby at that time.
Yes. So every year, a checkup will help us early diagnose these problem of nutritional deficiencies, and that is very
Right.
important to cater, because we also look at the child's performance in school and in sports. So going
Exactly.
forward beyond 6 years, so it is a time when the kids perform in school, and we are very eager to look at their performance. So what special investigations or what health check that we look at for 6 years to 12 years, 14 years?
Uh, See, now this is an age, where the parents are, okay, my kid is absolutely fine now. I don't need any checks and all those things because, the immunity levels, if I say, they basically get at a peak by 10 years of age, right? And if I say the puberty basically starts at around about 9 to 12 years in females and from 10 to 14 years in males.
Right.
So the most of the cases which come to us during this time are basically early puberty, right, or late puberty, right. So parents come to me saying, okay, fine doctor, मेरी बेटी तो 10 साल की होगी, 11 साल की होगी, लेकिन उसके अभी पीरियड्स नहीं आए, तो हमें क्या करना चाहिए, या मेरी बेटी 8 साल की है, लेकिन उसको तो अभी से पीरियड्स आ गए हैं, right. So these things, so I would suggest that these things should be discussed with the doctors, and these things should be investigated at that particular point of time only. So don't delay into those things, because there are certain there are a lot of causative things which causes these things, and if we detect these things early through certain investigations, then at least we can help the child to grow further without any issues of these. That is number one. So early puberty, that is called as precocious puberty, delayed puberty, तो ये दोनों चीजों को investigate हमें करना जरूरी है, और clearly discuss करना जरूरी है with your pediatrician, and then he revises what investigation and when to do it. That is more important, right?
When
Number
to?
one. Number two आता है आपके, nowadays see every five children out of 150 WHO says are obese. So, 9 to 12 years and beyond that is a phase where we find the kids are obese. Now, how do we term obese? मतलब भाई parents को आप बोलोगे आपका बच्चा तो मोटा है, so they take it
Yes.
aback. So
Yes.
instead of taking it aback, अगर आपको लग रहा है कि अर्ली डिटेक्शन हो रहा है आपका कि ओवरवेट के रिस्क आ रहे हैं, तो उसको वहीं के वहीं इन्वेस्टिगेट कराइए कि उसका कारण क्या है. देखिए जरूरी नहीं है हर बच्चा खाने की वजह से ही ओवरवेट होगा, राइट. इट इज नॉट like that. So there are certain diseases which can cause a child to be overweight, like simple as that, hypothyroidism. थायराइड की अगर प्रॉब्लम है, तो अगर थायराइड को हम अगर रेगुलर हेल्थ चेक से अगर हम early detection करें and we treat it at a time before it causes problems to a child, so obviously his growth and puberty age will always be a healthy time,
Very true.
right? So obesity, number one, number two, puberty, number three, thyroid. Number four, at this age, I suggest my parents that an yearly health check is absolutely indicated. That involves your regular health check with the pediatrician and investigations a necessity to rule out any organ problems like liver functions should be done, renal functions should be done, your cholesterol level should be done. For diabetes, we find a lot of diabetes these days, so sugar levels should be done. Your regular CBCs, your thyroid levels, your iron deficiencies. So this is the phase 6 to 12 years where you really need to investigate them thoroughly, which includes a set of investigations. Get an ultrasound done, get X-rays done, because why I say ultrasound X-rays? Because see, X-rays, if you find your child is regularly having coughs and colds, maybe your child is allergic. And at 9 years of age, you are coming in telling us, okay, fine, my child is allergic. So if we investigate a child early days, then maybe we will prevent our babies from getting into this phase.
Right.
So that is the reason early detection of a disease. So
Yes, sir.
preventing the disease to progress into a chronic illness requires regular health checks and investigations. So I
Yes.
would say, to summarize, once a year after 6 to 12 years of age, at least once a year, you should get thoroughly investigated with all the investigations, which include CBC, liver functions, kidney functions, lipid profile, urine examinations, and if there are diseases which are related to the early puberty or delayed puberty, then accordingly, considering with your endocrinologist, then we go ahead with a certain set of hormonal tests which has to be done.
Right, sir. So the health check जो adults के लिए करते हैं and the health check for children, any difference or it more or less it is the same?
See, Ratureka, health checks for adult and children are almost the same,
Same.
except few investigations which are more involved in pediatric cases. But overall, if you say on broad term, 12 to 18 years is normal, a growing adult, we say. So 12 to 18 years and an adult health checks are absolutely similar in terms of regular health check.
Yes.
So there are not much difference as such.
Right. Not, but there are few things that parents you should look for in the health check. Do not look at the price and go for the minimal smallest package वाला बच्चों के लिए ले लेते हैं. Don't do that.
नहीं
We
मैम
have to focus that
देखिए
vitamin levels होने चाहिए and
no but Dr.
vitamin
Rekha,
levels
see
of
I would like to interrupt in this. Better to get health checks rather than getting a child sick and admitting in a corporate setup and spending lakhs and lakhs of rupees. So better
that.
to get that health checkup done and be on a safer side and treat it in the OPD basis rather than pushing yourself into a hospital. Always better, na? That is a better way to do
Yes.
it.
Yes, but sir, selecting the right package is important these days
Yes,
because we have so many labs selling the packages with
right.
different, but the important test is missing from there, so it doesn't solve the purpose. So the test for children, the package when we decide the health package for children from 6 to 12 years, we should see that the package has iron profile and vitamin levels and thyroid and
Absolutely.
calcium. So these are the most
Absolutely. So
important.
these are the most important packages which we should be including. That is what I told. Thyroid profiles, the complete blood count. And sorry, I forgot about the blood group. That is very important,
Very
which we have missed. So that also is necessity when the child starts going to the school. The blood group should always be done during the health checks also.
So, what about the X-ray? Because many parents are hesitant on exposing the child to an X-ray when it is not indicated. Do you feel that health checkup, yearly checkup should include X-ray for children?
See, Dr. Rekha, I suggest that if an X-ray is being done once in a year, there's no harm in it. Okay. Now, why do we do X-ray? See, if you are staying in India, or I would say if you are staying at this part of the country, you are exposed to a lot of dust and pollens and all those things. In winter you are exposed to a lot of burning these things. So, ma'am, that way X-ray, why we say if your child is having a chronic history of coughs, colds, skin allergies, and regularly having skin problems, then yes, X-ray. I would suggest that yearly X-ray is no harm in doing it.
Wonderful.
Yeah,
Right,
number
sir. Very nice.
two, since we are very common, we are a country where tuberculosis is very common in our country. So, that is the second reason why we should regularly get the X-ray done, just to be safer side that yes, our,
Early diagnosis.
the parameters are absolutely fine accordingly. So yes, I think X-ray can be done on yearly basis. It is no harm at all.
Wonderful. So we have a question. The
Mhm.
importance of growth chart in a routine health checkup. How important is it?
See, like I told you, the importance of growth chart is important because that is the only indication which will tell you as a parent and me as a doctor that your child's growth and development is doing good. Now you have to understand the growth chart basically shows you the parameters like the weight of a baby, height of the baby, and the head circumference of the baby.
Yes.
Right? So what happens? It basically tells you the overall development of a child, where your baby's weight gain should be more than between 50 to 90 percentile. Same goes with the height and the head circumference. So yes, it is a very important entity. So whenever you are visiting your pediatrician neonatologist, make it a point that it is being marked every time there your visit. It's been marked about the height, weight, and the head circumference. So they do have an importance in your growth and development of your baby from birth till 10 years of age.
Wonderful. Thank you so much, sir. And sir, going forward from the age of 14 till 18, so this is a very critical age, and the children are also very, very in a tender age where they proudly call themselves young adults, you know. So,
Exactly.
how do we take care of their health, young adults?
Uh, See, I really, first of all, the most important thing I will tell the parents is see, this is an age where we need to be very precautious as parents.
Yes.
We need to, spend a lot and lot of time with the kids, because they are at a phase where they feel that they are young adults and it is basically the adolescent which we say. So there are certain behavioral issues which we normally encounter in our practice. Now these behavioral issues can be anxiety, depressions, related to the exam tensions and all those things. So during this time, the parents have to spend a lot of time with the kids, number one. And I would suggest that during 16 to 18, or I would say not even 16, I would say nowadays 14 to 18 years of age is an age where your child should be regularly investigated, because there are certain diseases which we find at this age which we have missed on the earlier phase, which may lead to certain behavioral issues at this age. So yes, it's a very tender age, and an age where they are very reluctant to certain decisions. But yes, like I told you, we have to spend a lot of time with them, and regular health checks for them also is a necessity. Regarding the behavioral issues, the aggressions they have, the adamant what they are, how adamant they are. So that is one thing which I think is necessity for them.
So, sir, as you said that medical health checkup जो health packages करते हैं वो तो it's standard that it should be done yearly. So, do you recommend that for the age group of 14 to 18, a mental health assessment is equally important and should be added in the yearly package, yearly
Yes,
checkup?
absolutely. See, now, like we told, they are young adults. Dr. Rekha, so they are young adults. So their health package is exactly same as an adult health package. We take it that way, right? So I suggest my parents to get an yearly health package, which includes everything, which includes all organ systems of the body, because this is a phase where they are going into a zone where we want them to be healthy adults further ahead, right? So there are certain diseases which, if we catch it at this stage, also we can give them a great healthy life further beyond, right? So, just reiterating certain tests like again the complete blood count, the liver functions for the liver, kidney functions of the kidney, the cholesterol levels, that is the lipid profiles, right? The thyroid profiles, vitamin D. So these are the main tests which we have to go in these kids, you know. So it is exactly same as an adult health package which they should also follow
Yes.
just to give them a great life further ahead.
Right. So their package should include the blood test, ultrasound, X-ray, and everything. But
Exactly, exactly.
it should also include medical health assessment by counselors or psychological assessment, or that is only when required, only when
Uh,
indicated. Should it be a
See,
mental health assessment? Should it be a part of yearly package, or should it be only when indicated?
Dr. Rekha, now in our country now, people take aback, oh, मेरा बच्चा ऐसा है, नहीं हो नहीं सकता, ये तो पॉसिबल ही नहीं है, ये तो मैं तो मान ही नहीं सकती, आप डॉक्टर साहब कुछ भी बोल रहे हो, these are the terms which we find. But if you ask us as doctors, mental health examination, or I would say the mental well-being of a child should always be included once the baby is 10 years, once the child is 10 years old. Not why it so late. It should start
Yes.
at 10 years of age. So, yes, I think that the yearly health checks which we do, so at 10, from 10 years of age, there's no harm if we include a mental health check for a kid, which really will help a child to grow with a mental, well-being during the, early ages like 20, 25, where they have to struggle with so many things. So
Right.
I would suggest they should go ahead and it should be included. That is a
Wonderful.
necessity from my side.
Right, sir. You very clearly you indicated why we should do mental health. It is important.
Absolutely.
So, sir, we see so many children with autism. So, at what age can we diagnose autism, and how can the parents see those early signs and feel that my child needs help, or I should take my child for an assessment? Um, at what age and
Right.
what are the signs?
Right, Dr. Rekha, this is a very important question, which, parents, they are very worried these days. So, first of all, let's say there are two spectrum of disorders. One is an autism and the other one is the attention deficit hyperactivity disorder, So attention deficit hyperactivity disorder, as the name suggests, the child is, inattentive in the school, and they are hyperactive. What does that mean? That if a child is in the house, he will just run here and there and here and there, and he will not sit at all at one place. And when you make him sit, his attentive scale will be very poor. So that is attention deficit hyperactivity disorder. So if I make it more easy, अगर आपका बच्चा बहुत ज्यादा हाइपर एक्टिव है, आपको लग रहा है इधर उधर उधर भागे जा रहा है, बिल्कुल शांत नहीं रह रहा है, आप बिठाने की कोशिश करें लेकिन वो बहुत फिजिटी है, आप बिठा रहे हैं फिर भी हाथ में कुछ ऐसे ऐसे करता जा रहा है, तो आप समझिए कि आपको किसी पीडियाट्रिशियन को दिखाना जरूरी है कि कुछ प्रॉब्लम हो सकती है. नंबर वन. Now let's come to a autistic disorder. Now autism is a different aspect altogether. Autism में एक बच्चा जो है, they basically, they don't have that eye contact with you. आपके जो पीयर ग्रुप है उनके साथ खेलेंगे नहीं. आप जब बच्चों को प्री स्कूल्स में भेजते हैं तो आप देखेंगे टीचर बोले आपका बेटा बिल्कुल अलग बैठा रहता है, एक्टिविटीज के अंदर साथ नहीं देता आपका बच्चा, हम कुछ बोलते हैं तो उसको ध्यान नहीं देता. तो ये सारी चीजें, these are all autistic disorders, right? And when to look, like you asked me, it is basically between 2 years. Further from 2 years, you can look into these things. So if any of these symptoms the parents are finding, then they should immediately get checked. जरूरी नहीं है कि होना ही है, लेकिन check कराना जरूरी है. Because autism can be caused by certain other conditions. So that is why we say get these things checked.
Right. So autism में any blood test, does the blood test help, or it is only the assessment,
Uh,
psychological assessment
Uh,
that help?
See, blood test, to rule out autism completely, or I would say to come to the diagnosis of autism, the blood tests are done to negate the other effects of the similar conditions.
Yes.
मतलब मेरे को अगर ऑटिज्म पक्का करना है, बोलना ही है मेरे को ऑटिज्म है, तो देखिए उसमें असेसमेंट तो है, जैसे असेसमेंट चार्ट हम कहते हैं, वो असेसमेंट चार्ट हम पेरेंट्स को देते हैं, वो तो करना ही है. लेकिन वो बीमारी ऑटिज्म ही है उसको पक्का करने के लिए बाकी की इन्वेस्टिगेशंस करने जरूरी है, जिससे हमें पक्का हो जाए कि हाँ ये सारी चीजें तो निगेट हो गई हैं, तो फिर ये तो है ही है.
Yes,
So
sir.
yes, when we really say that it is autism, then before that we have to, get other investigations done, blood investigations done, and
Yes.
maybe sometimes इसके अंदर हमें सीटी हेड भी कराना पड़ता है, अगर जरूरत पड़े तो वो भी करना पड़ता है. तो बिल्कुल करना चाहिए, इन्वेस्टिगेट तो करना ही चाहिए ऑटिज्म को 100% डायग्नोस करने के लिए.
Sir, I have seen a whole list of tests for an autistic
Yes,
child. The list of tests had come from US, and it was so elaborate. It was so elaborate. I was like,
exactly.
oh my God,
That's
ये
what I told
it
Radhika
costed
कि
around fifty
जब
thousand rupees for the list of tests, blood tests that was
yes.
done.
Yes,
So
absolutely. So there are tests because there are certain tests which are related to the brain which we do. So वो
yes,
करते हैं, कुछ टेस्ट हमारे इंडिया में होते
possible.
हैं, कुछ टेस्ट नहीं होते हैं, बट जो टेस्ट होते हैं मैंने बताया वही करने जरूरी होते हैं कि
Yeah,
हम रूल आउट कर सके वो चीजों को.
right. So again, coming to a little elder age group, many parents have this complaint that the child is not performing in the school. उनकी performance अच्छी नहीं है, वो लिख नहीं पाते, कुछ पढ़ाई नहीं करते, उनका ध्यान नहीं लगता पढ़ाई में. What do you think? Any medical condition or any test that can help them?
See, like I told you, invest medical conditions, yes. So I take it as again two-pronged process. One is the medical conditions relating to this kind of symptoms which the parents come to us, and the other condition is neurological assessment of a child leading to these conditions, right? So
Right.
diseases like जैसे ने बताया hypothyroid हुआ आपका, जैसे thyroid की levels है, then you would say obesity, right? Then you say because hypothyroid में you find the child is very lethargic, dull, they are inattentive, right? And they don't like to do anything. So these are things which you have to look into it. तो ये आपका हो गया एक disease process लेके चलो. फिर आपका दूसरा आता है whether your child is able to see the board or not properly,
Yeah.
So eye examination is important for them. Number three is basically your ear examination, whether whatever the teacher is saying, is he really or she really able to take it the way it has to go? क्या वो सुन पा रही है नहीं सुन पा रही है? So yes, certain investigations. Number one, your ear testings. Number two, your eye examinations. Number three, they are the basic tests to rule out any pathological disorder leading to this condition.
Right.
And if everything comes out to be negative, then you go on to a psychological assessment, which we discussed earlier, just before this, that what psychological, parameters we have to look into because of which the child is showing these symptoms.
Yes, wonderful. So, आपने बहुत अच्छे बताया कि yes, eye examination and ear examination, hearing test, audiometry test
Yes,
is equally important.
yes,
And parents, this is a good lesson for us that rather than pushing the child and scolding them, it is better to get the test done and see what is leading to this problem. Is the child
exactly.
struggling with it? Why is the child struggling and why is the child not a good learner? क्या eyesight is the cause or hearing is the cause?
Right.
Wonderful. Thank you, sir, so much. Now, sir, coming to the adolescent age group is such a critical age where parents really struggle to talk and discuss and to really, uh, they have a lot of doubts in their mind. Even when we think of drug abuse, substance abuse, is there any test or is there a way that we can really see the behavior and know that okay, there is a possibility of substance abuse and what should I do?
See, Radhika, there are tests available for substance abuse. It is not like that there are no tests available for these things, because this is a very tender age where, kids are tend to fall into a trap where, they go into a drug overdoses or drug abuse or, any other issues, because adolescent pediatric is something which really needs to be addressed, both as a parent and as a doctor, because normally we also, are not able to understand some things which, the kids are, making us understand. But this age, adolescent, is an age where they are more inclined towards going to, experience new things. and those new things create a problem for them, right? So, like I discussed earlier also, because a child who has a age from 12 to 16 years, if he is uh, having behavioral issues, like I told you, depression, anxieties, and all those things. So that way, I only told that those adults are more prone for these conditions in adolescent time also. So that's why investigating a child, or keeping a child on a regular health check from 12 years on a regular basis, which includes certain investigations and your regular health checks, both mental, emotional, and physical, will prevent the child going into a bad adolescent
Right.
age.
Yes. So any behavioral sign which indicates that there is a possibility of substance abuse? क्योंकि बच्चे आके तो बताएंगे नहीं, वो पेरेंट्स को जज करना पड़ेगा.
देखिए, see, the most important sign of which we really tell the parents to look into is that your child is, बिल्कुल जैसे कहते हैं ना कि they are either they are very aggressive, and they're very aggressive. Okay, number one, they will not listen to anything. That is number two, right? Number two, they are very fidgety. Fidgety in the sense, they just do like, they will just do like this or something, or they will just stare one thing or the other. These are the signs where you really have to think, no, there is something which is going wrong in my child. So they are the few signs. So aggressive behavior, aggressive means जो आपने अभी तक अपने बच्चे का नॉर्मल बिहेवियर देखा है, उससे बहुत ज्यादा एग्रेसिवनेस होना, बहुत एडमेंट होना, जिद्दी होना जिसे हम कहते हैं, ठीक है, छोटी छोटी चीजों में गुस्सा आना बहुत ज्यादा, राइट, ये सारी, नॉट टेकिंग इंटरेस्ट इन द रेगुलर एक्टिविटीज ऑफ होम और आउटसाइड वर्ल्ड ऑल्सो, keeping aloof from parents and their peers, they are the signs which really look into, yeah, there is some problem going with my child, where I really need to see and investigate him thoroughly.
Right. And parents, for your knowledge, let me tell you, substance abuse की जो test होते हैं, whenever you doubt there is a possibility, and we don't need a blood test, it is a urine test. So you just
You
need to bring
interest,
in a
exactly.
urine sample to us, to the lab, and we shall tell you what is the status. So I agree, when you ask your child for the blood test, they will not agree. So just manage to get a urine sample checked, and that will tell us the substance abuse. So now there is a question, sir. The question is, what is the right age for kids to start mild weight training besides going for sports and playing with friends?
Mild weight training. So, see, I advise my parents that till 12 to 14 years of age, or even 16 years of age, I say sports is the best medicine. You know, so pushing your child, or if your child is pushing you to, put him in a gym or something, I would not be very keen on putting them in gym till 16 years of age. Because gym, it is not a good way of, building someone's physical growth, rather than, I would say, put him in different sports, because right now these days our kids are more inclined towards indoor activities, and that is again, a gym is again an indoor activity. And I
Yes.
said, I prefer for the overall development, both mentally and physically, I would say that sports till 16 years of age is good. Beyond 16 years of age, yes, you can go with mild weight training and all those things.
सर बट आजकल कई स्पोर्ट्स ट्रेनिंग में जो ट्रेनर्स होते हैं ना, दे पुश देम फॉर जिम. आई हैव सीन इट, दे
So
पुश देम. द स्विमर्स हैं या फुटबॉल प्लेयर्स हैं, दे पुश देम, आप जिम जाके वेट ट्रेनिंग करो, यू नीड द मसल ग्रोथ,
yes.
एंड
So
दैट इज
I
वेयर
would,
द क्वेश्चन.
but Dr. Rekha, I still feel, that regular warm-up exercises is a different aspect altogether. Weight training, because she specifically about the weight training, I would not go ahead with weight trainings.
Yes, very
Okay,
rightly said.
warm-up
As a
exercises
doctor,
are okay. As a doctor, warm-up exercises are okay. Yoga, or stretching exercises, and all those things are good, okay, before any sport. But specifically going into the gym and going with mild weight training, I would really not suggest those things, because you are not going to gain anything on that.
yes. So, as a doctor, we would never recommend any child to go for gym training or weight training
Absolutely.
exercises.
At
If
least till 16 years of age,
yes, up till 16 years of age.
I
But
would
still,
say.
when I see the parents' dilemma, कि trainer ने बोल दिया अब क्या करें? So parents, this is for you that ask the sports trainer to train them to any extent they want, but the child will should not go under the gym trainer. That
Exactly.
is, it becomes contradictory. You know, they will take them into a different direction. You keep the
Absolutely.
child to whatever training it is, but under a sports trainer. That is the best decision. So, wonderful, sir. And coming out to obesity, and the other question is PCOD and precocious puberty. So, these are the adolescent problems that the parents face, and there are a lot of child who gets up into weight problem, PCOD, and hormonal issues. So, how early do you recommend hormonal treatment for young girls?
See,
What
Dr.
age
Rekha,
can we
first of
start?
all, yeah, so normally, first of all, we have to diagnose whether your child is really obese or not, because, at this age, which you're talking about the adolescent, every child, every girl thinks, oh, mera weight to bahut zyada ho gaya hai.
Yes.
And then they go into a wrong frame of mind to, start losing weight. So first of all, that is very important as a parent to make them understand that this is the ideal weight for you and this is the ideal body mass index for you where you are perfectly fine. That is number one, right? Number two, if you find that your baby is overweight, or I would say there are risks of your child getting overweight. Now, how will you come to know that risks? So those risks, to come to know about that risks where your child can become overweight, you have to investigate a child. Now, if you find your child is basically, having any issues related to, precocious puberty, which you told, where, we find that parents come to us, she started menses at an 8 year of age, and, there are secondary sexual characters which have started appearing early as the normal pivotal age, then yes, the investigation should be done at that age only. So I would say investigations, even if you find few of these symptoms at 8 years beginning, then you should do it there and there itself, so that if we send you to an endocrinologist, then at least they do certain specific and hormonal test to rule out those things, and accordingly they take a decision that time itself to treat them in a way that they have a normal, adolescent time that way.
Yes. Sir, investigations तो जरूर कराते हैं. We do get the investigations, but the challenge comes: can we start hormonal treatment for young girls or not? But yes, as
See,
a
young girls normally we say that hormonal treatments we don't start so early. We basically it's too early to start the hormonal therapy because ये बहुत this is a very common question कि parents come sir अभी hormonal treatment start करना है या नहीं करना चाहिए. So see, as a pediatrician I say no. But still, if I go on a parent's behalf, I refer them to a pediatric endocrinologist so that they take it from there and they decide whether the hormone therapy has to be started, and if it has to be started, what is the right age and
age.
what are the investigations accordingly. The child really requires a treatment or not, that depends
Yes.
upon those things.
So parents, if of all girl children, you have to know that there is a problem of precocious puberty, PCOD, weight gain, obesity as the child becomes beyond 10 years of age. So be watchful, and prevention is better than cure. So get them for medical checkup at an early stage. Weight gain control करने की जरूरत है. Put them into physical activity. Let them not get into that loop of obesity and hormonal issues. So, as a parent, we should hold their medical issues right there and prevent the hormonal problems. And that can be done only by medical checkup, yearly medical test, and consultation with the pediatricians. So, sir, your thank you so much for giving us a wonderful insight. And if there's any more questions, you are a masiha for today's parents. Yes, I agree with you. Devan sir is truly a masiha for all parents and for us. Thank you so much, sir. So, what will be
No
your
worries.
final takeaway for parents?
See, my final takeaway is, see, for children, the right to health is vital, because they are the most vulnerable beings, more at a risk of illness and health complications, right? So, as a parent, we should understand and make it a point that early detection is important rather than to, repent late that if we had done it earlier, it would have been better.
Yes.
So, spend time with your kids. That is number one, very important. Try to spend maximum amount of time with your kids because the more you spend time, the more they are physically, mentally, emotionally healthy. Number one. Get regular health checks. Like I told you, yearly health checks is a necessity. Like we both have been saying, prevention is always better than the cure. So go on to that phase. And last thing, an apple keeps doctor at the bay. So if you want to prevent, see not don't want to see a doctor regularly, get the test done and be safe.
Yes, thank you so much. So well said, sir. But yes, as Dr. Vineet said, yearly checkup will prevent lot of issues, and as a parent, will definitely keep you happy because you have already looked at it proactively and not wait for the disease to come in. So
Absolutely.
my suggestion to all parents is thank you so much for joining us, and my final this thing will be, as the vacation is ending, is just 1 week left. If you have not done so till now, please take your child for a health check to your pediatrician, get the medical test done, the eye checkup, the audiometry test, and blood tests, get their thyroids checked, get the vitamin levels checked. That will assure their performance for next 1 year. So till the next vacation, their performance in the school, in the class, in the sports field, everything will be taken care of if we have done the basic test and keep up with their health. So that is very important. Check out with their vaccination card what vaccines are missing, what height, weight, what needs to be done. Just spend a day, get them to the pediatrician, one visit, and you are done. And Dr. Vineet is available at Wellstar Clinic every day from 7 p.m. to 9 p.m. You need his help, please call us and book an appointment with him. We do blood test as well. If you need a blood test for your child, do call us and book an appointment. Thank you so very much for joining us and wishing you a happy Sunday and happy vacation. Thank you. Thank you so
Thank you.
much,
Thank
sir.
you,
Thank you.
Bhavin.
Thank you. It
Thanks a
was a
lot.
pleasure.
And have
Thank you
a
so
and have a good day, all the parents. Bye
Good
bye.
day to all of you. Thank you, sir. Good
Bye
day to
bye.
you too.
Yeah, sure. Bye bye. Thank you, dear. Thank you.
Thank
Thanks a lot.